Dr. Adam Nally, counting calories is high risk to your health. From his MeatRX YouTube interview by Dr. Shawn Baker.
I've been in private practice since 2000. I did some. I'm a family physician, board certified, and obesity medicine specialist, also board certified. My current practice, I'm a very busy, full spectrum family physician in the northwest corner of the Phoenix Valley. I do a real heavy component of low carbohydrate, ketogenic or carnivorous type diets with patients, and have been for the last, I think, 16 years. When I came out of school, I'm sure with you, for the first 5 years of my practice, that's what I told people is, cut your calories and exercise your brains out. And I literally had patients that did that. They would show up in my office with logs of their exercise and their either calorie restriction, their diet. And they were cutting their calories to 1,000 calories a day, and they were exercising an hour a day, and they were not seeing success, and they just were not successful. And so that was one of the big drivers behind me going further, trying to understand what's driving obesity, what's driving our health, and how does nutrition play such a big role. And most physicians that come out of school, the majority of their training after school is from a drug rep in the office or from a conference. And unless that conference has an emphasis on the right type of nutrition and how to assess the right type of nutrition for the person, I think a lot of them still get lost. And I still have nephrologists today that actually call me up and say, I don't know what you're doing to the patients, but they're actually getting better. Can I come and sit with you and find out what you're doing? And so because their kidneys get better. And it's amazing to me. I have cardiologists that still, last week I sent a patient to the cardiologist and he says, I don't know what Dr. Nally does. And don't tell me because I don't want to hear it because I know it has to do with fat, but just do what he says and don't tell me about it. I was like, are you serious? Is this, so I think physicians are tired. They don't understand they don't have some of the background that helps them understand that the dogma we've taught people about fat for the last 50 years is wrong. And they're still stuck in that calorie in, calorie out mantra because it's easy. It's easy to say, cut your fat and here's a pill. The challenge that I see when people come in having followed that type of a dietary approach is I see 5 major issues. Number one, their cholesterol never goes down. I see their small dense particle stays very high. They're not esterifying cholesterol at all, which is atherogenic for the whole body. They're increasing the risk of heart disease and stroke. And so unless you actually turn down the insulin drive, number one, as one major factor, and then others that relate to that, you'll never see the cholesterol levels normalize. You'll never see the cholesterol become the type of cholesterol that's healthy. It all stays small dense, and your LDLs are very atherogenic. Second issue is that that insulin stays elevated because the only type of food you're able to eat is a carbohydrate base. And for 85% of the people that I see in my office, that insulin is the driver behind the inflammation. So their arthritis is worse, their psoriasis is worse. In fact, yesterday I had a patient that came in and she says, well, I'm kind of doing low carb, but her psoriasis is still raging. And every patient I've ever seen in the last 16 years that does a ketogenic or carnivorous diet, their psoriasis stops, either goes away completely or diminishes by up to 75%. So these inflammatory diseases like rheumatoid arthritis, psoriasis, eczema, all these issues, even reflux and heartburn goes away when you actually switch the diet correctly. Third issue is when you cut calories for longer than 7 days, you actually see testosterone drop by 50%, and then you can't maintain muscle mass. And I see guys that, I see guys every day that show up in my office with testosterone of 170. Most men feel horrible if their testosterone is not higher than 450. And unfortunately, there are so many of us in the United States that have followed this mantra that they actually shifted the normal value for testosterone 2.5 years ago from 450 at the baseline of normal to down to 200 as the normal. And so just 7 days of calorie restriction drops your testosterone by 50% for both men and women. It also 7 days of calorie restriction suppresses or turns down your metabolic rate. And to some degree, that's permanent. At least that's what I see clinically. And so that's the big challenge is if we just cut out calories, yeah, you'll lose weight. Absolutely. You'll lose 20 to 30, maybe even 50 pounds if you're lucky. But the challenge is you'll never see your cholesterol get better. You'll never see inflammation improve. And you'll never actually feel good because your male and female hormones will never be balanced. You'll always have that little pot belly around your middle. I've yet to see a patient who does pure calorie restriction alone get rid of that little pot belly around their middle, because that's a sign of, in my practice, estrogen dominance, which is driven by a lack of appropriate calorie, and you have to have cholesterol in order to make adequate sex hormones. And if you're not making them, you stay estrogen dominant. Both men and women do. That's a big problem.
Summary. Cutting calories causes 1. Insulin to remain high. 2. Cholesterol cannot normalize. 3. Inflammation to grow. And 4. Cutting calories causes testosterone to drop. Low-carb diets stop and reverse rheumatoid arthritis, psoriasis, eczema, and reflux.